Hi, everyone. My name is Risheet Patel, and I am the medical director at Freedom Healthworks. And with us, we also have Jason. You want to introduce yourself?
Good evening, everybody.
We are going to start this webinar here in just a minute. A couple of things. Um, we have a chat open. If there's any issues with being able to hear or see the webinar, feel free to jump into the chat. Melissa is monitoring that, so she might be able to help you out. We are hoping to have some time for questions and answers at the end. Here in this Zoom meeting, there is a Q&A section or a Q&A feature. So as we go through the webinar, if there are questions that come up, feel free to add them into that Q&A section, and we will try to get through as many as we can as we continue through the webinar. So without further ado, I think we're going to go ahead and get started. This is being recorded, so if you will get a email link to the recording tomorrow, and all the attendees, even if they weren't able to join us this evening, will get a recording. So we'll go ahead and get started. So let's do that here. So we first do want to thank a couple of our partners, Spruce and KPI Ninja. Definitely helped us to promote this webinar, and we do appreciate their support with this moving forward. Just a little bit about myself. I'm a family physician, and I finished my training in 2007, and right after that joined one of our hospital networks here in the Indianapolis area, and was with a traditional family medicine office. Over time was looking to find ways to provide that primary care in a little bit different fashion. So in 2015, I joined a company that does a lot of employer-based health, with near-site and on-site clinics. It was my first taste into providing primary care outside of the insurance framework. But then wanted to kind of really have my own office. So in 2017, opened my own direct primary care office, Fisher's Direct Family Care, and I've been practicing there ever since. And for the last year or so, have been working with Freedom Healthworks as their medical director to help other physicians open and grow their own direct primary care practices. So just a little bit about my background. Jason, if you want to introduce yourself.
Yeah, so my name is Jason Rutz. I come from the other end of the spectrum from Dr. Patel. My background is in the dreaded insurance company. So I worked 10 years with United Healthcare. Actually, my division of United Healthcare, we were the epicenter, the originator of the medical savings accounts, the health savings accounts. So did a lot of work on self-directed health spend and its causes. So I'm, DPC is near and dear to me because of its transparency, and I think it works well with health savings accounts and other insurance products. But since then, I've been in technology, and then came back to healthcare with Freedom Healthworks, and been with Freedom Healthworks for just over 3 years.
Well, sounds good. Jason, if you want to kick us off about a little direct primary care info.
Yeah, so I found this quote actually on the AAFP website. I think this is a better definition of direct primary care than I think I could have come up with. But really, it's all about focusing time on patient care, and autonomy is kind of the other theme with direct primary care. So practicing the way you're trained, and caring for your patients, and those are the two themes with direct primary care. And so that's why I think it's worked so well so far. Is it's really getting back to the core of what medicine should be, at least on the primary care level.
Okay.
So some of the advantages to the DPC model, I'll run through this for those of you that maybe aren't as familiar with direct primary care. So again, direct primary care is a direct patient to physician relationship, and so really the whole the benefit of direct primary care is the fact that nothing stands in the way of those two entities. And so for the advantages from the physician side is it's a much more efficient model. So it allows you to deliver really good care and really good value to the patient at a really good cost. Patients have, or you have, as a physician, you have direct access to your patients. More time spent with your patients, so that can vary. So we have doctors that are that practice on a functional medicine philosophy, and they spend a lot more time with their patient, but the model is able to work for them. One thing that our physicians always talk to us about is the fact that they kind of regain control of their work-life balance, and so a lot of cases this is transformative for the physician and their families because they're able to be in control a little bit more of their work schedule and spend more time with their family as well. So it's kind of a win-win in that scenario. From a patient standpoint, is you get personalized care, and that's where the autonomy comes from. So not every DPC practices the same. Not every physician practices the same way. And so that gives the individual the choice to choose the doctor that best fits them. They have direct access to the physician, which is kind of an unheard of concept. And so that's generally done through technology. And so we'll talk about that today. And better health outcomes. So this has been proven through a number of studies that, and as well as lower cost. But both these things have been proven just because of the time aspect, the relationship aspect, which not a lot of people talk about in DPC, but it's those two things. You're solving access, you're solving the relationship, and creating a really good bond with your physician. And so both those things really, benefit the patient really well as far as their health and their overall cost of care over time. So the importance of direct care is high value. So, direct primary care practices probably average $70 to $80 a month. So it's extremely high value. So there's no copays, there's no deductibles, there's no fees due necessarily other than the monthly membership. And so that's a lot of value for the patient. Strong relationships. So I can't emphasize this enough. So it's more than just access, but, strong, direct patient-physician relationship will just increase satisfaction, increase trust with your physician. We have a physician that kind of said it best, but they practiced 15 years as an independent fee-for-service doctor. In the first 6 months of practicing as a DPC physician, she said she learned more about her patients in that 6 month time period as being a direct primary care physician than the 15 years prior of being a fee-for-service doctor. And so I think that rings true for a lot of physicians. It's a broad approach to medicine. So we hear a lot of times that it kind of challenges doctors again, because now their expertise is put to the test, and they do things that maybe they didn't do before. So maybe those minor procedures and things that maybe they were trained on, but then lost touch of by being kind of in hospital-based medicine. And then cost savings. So we talked about this before. So again, that's going to be a theme here. So this webinar is about technology. And so technology, at least from our perspective, is pivotal in the success of these relationships. So a direct primary care practice is kind of a micro practice. So it's not like you have a large staff of people to manage. It's typically one doctor, one front office person. So we need to make sure that the practice is running smoothly and efficiency. So that's what technology brings. It brings greater efficiencies. It allows you to manage your day better. It eliminates the need for staff and overhead, which is why the model works. It promotes better workflows. So interconnectivity between systems, helps eliminate redundancy and creates efficiencies by itself too. And then creates more flexibility for the practice and patients. So again, patients have the ability to interact with you on a virtual level. The practice can, if you go on vacation or the front office person is maybe out sick or on vacation as well, it creates remote capabilities. So basically, with your smartphone, you can take your practice with you wherever you go and still interact with your patients just like you would be sitting in your office.
Okay, well, I appreciate that nice overview, and we're going to delve into some of the technology here moving forward here. So what I wanted to start with is just a theoretical concept of how we start looking at some of these systems. And some people that might be on the webinar that have a background in software or production or selecting systems may kind of be aware of this paradigm, but there's a little bit of a kind of theoretical difference between this best of breed philosophy and the best in class philosophy. So the best of breed, if you think of that as like a single hammer, is a piece of software or a tool or some type of system that really has one specific goal. So in our case of a DPC office, we'll look at different categories of software or services that we need. So one approach is to find the best piece of software in each of those categories and then work together with them. The other approach is to take the best in class approach, and that you can think of like an entire toolbox where maybe one system or one program really can handle all the different functions that we want from that portion. So, there's no one right or wrong way of doing that. I think there's a number of factors as you're looking at your own office or your own system that you want to do. Cost might be an issue, the interoperability between the systems, kind of what are the actual features that are involved. So as we go through some of these slides moving forward, you'll see that you might see the same names on certain slides, and so that kind of shows some of the software actually can do more than one thing. So I think it's important to kind of think about that approach when we're looking at the different systems that we use. So let's kind of go through some of the essential software. These are things that I think any DPC office definitely must have to function properly. So at the heart of our DPC office, we are a membership office. So we build those relationships with patients. They become members, they charge monthly. So we need a good system to help manage the membership and the billing that goes with our systems. You can see a number of the partners that we have worked with or kind of are in the DPC space here currently. Some of them are definitely medical. Hint and Atlas and Twin Oaks are related to DPC in general. But even a system like Square that some people might use for other, you might think of those as the card readers that you see at the farmers markets, but they have pretty powerful software that can handle memberships and do those types of things. So I think when we look at the actual features that you're looking for with a membership in our office, not only handling one set of recurring fees, but a lot of us do different tiering and pricing, such as age-based tiering, that type of thing. Some of us have discounts for family memberships, so having a system that can be flexible and provide that family membership aspect in there. And then also working with employers. So I know a lot of us do work with employers, and so having the ability to kind of have that roster of employees from an employer, or even at a larger level, being able to split that roster amongst different offices might be kind of some of that advanced features that you might see in terms of the membership billing. So that's kind of the core of what we need. The other thing that I think goes along with that is the ability to do one-off billing. So we have a lot of times in our office where we will charge one-time things for labs or medications or supplies or different things like that. So having the ability to have a quick way to charge those kind of one-off items, I think, is important as well. So that's kind of the crux of our system, is really kind of keeping a track of who are members in our office, make sure we're collecting the billings and being able to collect those one-off payments as well. So that's kind of one of the first essential pieces of software to get started. Right after that, I've put electronic health record. Now, in theory, I know there are DPC offices out there that actually still work on paper charts, and so you don't necessarily have to have an electronic health record. But I think for the most part, most offices, most physicians are looking at electronic health records and will use one system or another. Now, I know when a lot of us are back from our employee days, or when I used to work for the hospital system, and I think of an EHR, and all I get are little nightmares or flashbacks of meaningful use and CPT coding and bullet points and all of that stuff. But the nice thing in DPC is we're not doing all of that stuff. So we really just need a system to keep a track of our notes. As I see a patient, I want to keep a little record of what I did that day. So even for myself, when I see the patient again the next time, I have something I can look back to. If we need to share notes with a different provider or a specialist, we have a nice note to send that off. And then also just for a medical legal purpose, if we ever needed to present our records for for a legal case of any type, it's there documented what we did. So in that sense, almost any of these systems can be pretty easy to use to kind of create simple notes and keep a track of what we do. I think the individual physician may then want to look at what other bells and whistles do we want to have in our EHR that we want to take advantage of. So I personally like to e-prescribe, so having a nice e-prescribing system that can send prescriptions through SureScripts to all the pharmacies, including controlled medications, was important to me. I like to have a lab interface, especially a bidirectional one, where once we've arranged our relationship with our lab locally, we have an interface where I can put in the orders electronically, get the results back electronically. That kind of helps the workflow. Patient portals are something that a lot of patients are looking for. So having the ability to look at lab results or immunization records or vital signs online, that can be something that's important. Some of these have things like faxing and communication messaging kind of built in as well. So I think that's when you start looking at what are some of the other things that you want your EHR to have, and you can kind of look at the different options and the different systems that are out there. But I think at the crux, again, we just need to be able to keep track of our notes, keep a schedule, kind of make sure our patients are taken care of from that standpoint. And I think it all kind of builds off of that then moving forward for our electronic health record. The other thing I think is really key, Jason touched on this in the opening kind of portion there, is really having a robust communication platform with our patients. Direct primary care at the heart is the relationship that we have with our patients. It's us and them. And yes, we clearly see patients physically in the office. They come in for appointments. But nowadays, we really move beyond that. We provide so much care outside of the exam room. We communicate with them through text messaging, through phone calls, through kind of our secure apps. And so really having a robust platform that can manage that, I think is very crucial. So at the core, I think being able to message with your patients is kind of the first step. Some of these can do it directly with just text messaging or SMS messaging on the phone. Some of them have a more robust portal or a secure app to use. And so that can be a way to, if we're concerned about a little bit more security and want to be take care of our HIPAA compliance type stuff, there's those secure options to provide that messaging in there. Some of them have built-in questionnaires, so you can do e-visits through some of these where, let's say somebody wakes up in the morning and they have a little bit of a cough. The software that we use actually will have that questionnaire built in to kind of facilitate the data gathering from the physician standpoint. So that can be there as well. And then some of these systems move beyond that. So we talk about messaging, but then email and phone calls are things that can be tracked and recorded as well. So Spruce, for example, has a unified timeline of communication where all the patients' interactions with the office, whether it be by telephone, by messaging, by email, all get kind of put together in one stream. And so that kind of becomes a nice way to look at what are all the interactions I've had with that patient through whatever modality they're using. So kind of having that ability is nice as well. So I think whatever you use, having that ability to communicate with patients effectively is definitely important. And the other thing that we see sometimes is the actual video visits as well. So I think we're all familiar with Skype and FaceTime, and so some of these platforms can do those types of video visits right through the platform as well. So it's really important. So I think this is kind of a key thing. We are, again, a relationship office, and we want to have close communication with our patients. So having a digital platform to be able to do that, I think, is one of the key essential pieces of software that we want to use. So there's a few other types of software that are maybe more optional. So the first one I would look at is medication dispensing or inventory management. So I personally, in our office, we dispense medications out of the office. So having some software to be able to track the inventory that we have and be able to dispense that out is definitely important. Now, a lot of times when you first start, so even in our office, for example, we didn't do that for almost a year. So this may not be something you need right away, but over time, as your office grows and you might be then doing more of this medication dispensing, you might want to look at some of the software. So software, they vary quite a bit from state to state as the regulations do. So I think it's good to have different software that might be able to help you keep track of what's needed for your state in terms of what's supposed to be on the prescription labels, what's on the in terms of the lot numbers, expiration dates, that type of thing, and then really just trying to keep a track of that inventory as well. I know recently we've had a lot of recalls of medications, so having a quick way to be able to look at what inventory do you have, and does any of it need to be checked for recall, or do you need to call patients to get that back? So, so again, really being able to manage that effectively. So there's obviously ways to do this on paper, but I think having software doing that really just makes things simple and easy. And so kind of looking through that would be a good way to go. Another optional thing I think we're starting to see a little bit more are these connected devices. So I think for the longest time, we've had some home devices, blood pressure cuffs, and obviously scales and glucose meters, but they're all starting to get quote unquote smart, where they're now kind of starting to submit data up to the cloud, and maybe it's just for the individual end user, but I think we're starting to get some of these services that are actually providing portals for physicians to then collect this data and look at our patients' readings at home. So again, an optional thing, and I think this is going to depend on your patient panel and what you're comfortable with as a physician, but as we see more and more of these home devices start to become smart and connected to the cloud, I think there's just going to be a glut of data. and having some type of service that can actually collate and collect this data for us to look in a meaningful way is definitely going to be important. So that's going to be something that I think we'll look at moving forward and seeing if we can kind of monitor that. And the last thing I put up there is more of this data analytics piece, which we'll talk about a little bit more in detail here as we move forward. We have all these systems, or kind of whatever systems you choose to use for your billing and your EHR, and they all have their own reports that they may run. But if there's a way to kind of collate that data together to kind of say, how do we look at this data across all of the systems we use? I think we can make some really meaningful decisions and insights on that, and we'll talk about that here moving forward. So KPI Ninja is a DPC specific or a healthcare specific company that really can collate a lot of this data. Tableau is another company that does more generalized software and data aggregation, does not necessarily only for healthcare, but is another piece that we've seen used in this space. So these are kind of higher level things, maybe out of the reach a little bit of an individual office, but maybe working together with multiple offices or an organization like Freedom Healthworks. I think we can see kind of where maybe some of this data analytics might be beneficial for your practice as well. And we'll highlight some of that here moving forward. I want to touch a little bit on hardware as well. So most of the software we had just talked about are kind of web-based or have, don't really need a physical download or an application. So really how you want to set up your office in terms of the hardware is up to your workflow. So we know computers, a desktop computer or a laptop might be a little bit more powerful than a tablet might be or an iPad. But you get a little bit of flexibility and portability with the tablet. So I think it's important just to think about your workflow in the office of how are we going to see patients, what rooms am I going to use, what's my workflow going to be. So picking the right hardware to run all these software systems is definitely important. Some of the other hardware in the office, we try to, even in our office, try to eliminate paper as much as possible, but we always are going to have some need for paper. So we've got a printer to print things off, forms, that type of thing. Then we have a scanner to get that information back into our systems. So signed forms, ID cards, insurance cards, we always have a need to scan some of that back in there. And then faxing as well. For some reason, faxing kind of still hangs around in healthcare, so we have to have that ability to fax things. So nowadays, a lot of the faxing is electronic, so we have software fax solutions. So you don't need a physical fax machine. Maybe the scanner is all you need to get that paper back into the system to be able to fax. But if you did want to have a separate fax machine, you could do that and have a phone line for that. That definitely would be an option to, as long as it fits in your workflow, to do that. And then same thing with telephones. A lot of the systems we had mentioned before, Spruce, for example, can, the phone calls can be answered directly onto your own mobile device. And so maybe when you're first starting out, or if you're a smaller office, maybe you don't need a separate telephone, maybe your own cell phone will be enough. But once you get to a busier office and maybe you have a staff member or two, having some physical phones in the office that can tie all this together really does improve the efficiency of the office. So that's something to kind of consider as we're looking at setting up how the office system and how the flow is going to go. The other thing I want to touch on are some medical devices for hardware. So I think a lot of us, especially maybe from a hospital network or a big physician group background, are used to the kind of big bulky devices, the hospital grade EKGs and spirometers, and they're quite pricey and they're quite large. So a lot of times they take a cart of their own. But nowadays there's a lot of new devices out there that are more portable, they're less costly, and they may sync up with an iPad or a smartphone and can really provide a lot of great care. So with EKG monitoring, there's a couple devices. AliveCore has a device that is called the KardioMobile. It's just kind of a one lead device where a patient just puts their fingers on it to get the reading. The SmartHeart Pro is a new type of EKG machine that looks a little bit different than your typical 12 lead, but still gives you a nice 12 lead report on your from your EKG reading. That Nuvo Air device that I've got pictured there is a spirometer. So it comes with a mouthpiece as well, but it's this really small handheld unit that syncs to an iPad that can really provide pretty good spirometry results at a pretty affordable cost. So that's something, if you're looking to add that into your practice, might be a way to go. Point of care ultrasound is all the rage these days. So not only in a traditional fee-for-service office, but in direct primary care offices as well. Really one way to bring a lot of value to our offices. So the Butterfly IQ is definitely one of the hottest devices around. It's not the only point of care ultrasound device, but definitely it's quite popular. And so again, just looking at ways to bring value into the office to do that. Some of the other things that if you're doing a lab analyzer, So whether it's some of those point of care type units or an actual full-on lab analyzer, like a CLIA non-waved, a CLIA complex type device, if that's something where you feel it would bring value, you've got some the patients to do that, then that would be something to think about. And then a pill counter might be something else. A lot of us that dispense medications, if you are really looking to kind of go with the cheapest route, buying those bottles in bulk and then using a pill counter to divide them into smaller bottles might be a way of really kind of bringing some of that value to our patients for dispensing medications. So just kind of a quick touch on some of the hardware that we can use in our office, not only from just the basic office supplies, but also some of these medical devices. There's a lot of neat devices out there. And so again, being in direct primary care where we're not billing and coding individual things, it really opens up the possibilities for us to take advantage of some of these devices. So we're going to move on here. I'm going to turn it back over to Jason to kind of dig in a little bit more on Freedom Healthworks and how we maybe use some of this data moving forward here.
Yeah, so thanks, Risheet. So kind of our mission, for those of you that are not familiar with Freedom Healthworks, so our mission is to create an ecosystem that creates all these support systems from a data aspect, from a knowledge aspect, from a resource aspect, and do it at scale that allows physicians and consumers, your patients, to thrive. And so that's essentially what we're trying to do here, talking specifically about data. If you want to advance the slide there, Risheet. So we talked about, this is a question we ask ourselves almost, every day. We ask, how do we give physicians who want to move into the DPC model the best opportunity possible? And how do we build a solid foundation for DPC to scale and continue to innovate? So bring those things that constantly create more efficiencies and better patient care and those things that really matter within practices. So we have a unique approach. And so our physicians are completely independent. They own their own practices. So we don't employ physicians. We help empower those physicians to go into DPC. And so, essentially our mission is to scale DPC and create a ton of really good opportunities for doctors that maybe have thought about direct primary care, but never thought of it for them. Really good opportunities for them to jump into direct primary care and again, help grow the community of DPC. So this is essentially why Freedom Healthworks exists. So we, and by we mean you, the physicians here, have an opportunity to change healthcare from the bottom up. So starting with primary care, the most core of the patient, patient needs as far as healthcare goes. Yeah, there's incredible potential to impact people's lives, and we see it almost every day from our practices that we work with. And countless stories of ways that just time and relationship is able to really solve a lot of problems that people are having with their health. We also want to eliminate entities that don't provide any value in primary care. Again, because we work with independent doctors, we have a firewall where we have to provide value, and we can't stipulate what practices do. What we want to do is we want to create an environment that is the best possible scenario for practices to follow. So a really good, base operational structure, and where we see all of our practices practicing really, really well. And the DPC is proven to work, so why not expand it? And so we're really finding ways to expand DPC and again, make it, bring about more opportunities and make it a more satisfying experience for everyone involved. So now we're talking about data, but how Freedom Healthworks uses data. So probably all the systems that we talked about, they're very slick and they have a ton of functionality. So it's probably akin to like my father, my 75-year-old dad, who may in the future or something buy a Tesla and has no idea how to use it. And so not saying that, all of you don't know how to drive a Tesla, but there's a lot of functionality that I think we've learned over time, the best ways to use that functionality and how to engage with that functionality. So from a data aspect, the ability to get deeper insights into the practice, and that insight is shared with our practices so they can operate better as a practice. Customized clinical and operational data. So again, ways that we can help guide you into making the best decisions for your practice. Actionability, so making sure that the data that we're providing is actionable. So whether or not there are issues or successes within the practice, you're able to make actionable decisions based on that data. And then I guess the most important thing, and what's going to cause, really help us drive direct primary care further and expand it, is the data is really important to drive employer relationships. And so that's kind of a pivotal aspect of them understanding the relationship of their employees to the practices. And it could be, one employer to multiple practices. And that's something that's not necessarily being done right now. So we're kind of on the forefront with that. So our data partner, which Dr. Patel had mentioned earlier, so our data partner is KPI Ninja. So they're the ones that that aggregate all of the data from our systems. We've created custom reporting based on the data that's being fed from those various systems, and create the key metrics that the practices rely upon to practice, and we rely upon to help give direction to those practices. And so again, from a systems point of view, so it creates deep insights based on the patient management system, the EMR, and your unified communications tool. And for us, those are our preferred vendors for those are Spruce, Elation Health, and Hint Health.
Okay. Well, should we move into our couple examples here?
Sure.
So I think, as Jason said, we use KPI Ninja to kind of aggregate a lot of the data from our systems. And so our first example is Naptown Priority Health. They're a DPC office here right outside of Indianapolis. And so we were working with the physician there. And after we were looking at some of the data, we found that one of the areas that he was struggling in was actually in collections. So there were several patients who were kind of behind on their monthly membership fee or some of the other billings that they had. They were a busy office, and so a lot of that kind of got missed. And so they were providing care to patients who kind of were a little bit behind on their payment. And it's one thing to kind of give some patients some leeway, but I think one of the things that was happening is they weren't aware of it at the time of the patient was being seen for whatever reason. A lot of times it may have been that messages were coming in or phone calls were happening, and so you're trying to do the best you can as a physician, and you kind of miss the point of, oh, you're a little bit behind on your payment. And so what we did is we kind of maybe switched up some of the systems that he was using to kind of make sure that they were more integrated. So we were talking about, as Jason was pointing out, the EHR, the communication platform, and Hint, our billing platform. We were able to get them all talking to each other. As now the physician sees, whether it's in the EHR or in Spruce in the communication platform, you are actually able to now tag that patient is kind of behind on their payment. And so while we still are providing great care, we can then just gently mention to the patient, hey, it looks like you're behind on your payment. Can we do anything to remedy that at this time? And so it really was able to kind of say, hey, we are still taking care of our patients, but just having that information in front of us now gives us the ability to kind of be a little bit more actionable, as Jason had mentioned, on trying to collect the money or trying to get a little bit ahead of our revenue and make sure we're getting paid for what we're doing as well. So this was a kind of a great example of a practice that was a little bit kind of struggling in that sense. And it was just really just a tweak of some systems and kind of tweak of some workflows. And we were able to kind of really kind of turn that around a little bit and get that physician, those payments up to date as much as possible. So Jason, anything else you want to add on kind of how that came together?
No, I think you covered it.
Okay, so it was kind of a fairly simple one of kind of looking at some of the data. Our next example was a little bit more complex, and this one took a little bit of work on all of our team parts to help out. So Old Family Medicine in Carmel, which is again another suburb here in Indianapolis. Dr. Olp is a very busy physician. She has a very large patient panel in her direct primary care practice and was starting to feel a little overworked. She was starting to feel that, hey, my schedule is completely full. I feel like I'm having maybe a little bit of trouble getting patients in a timely manner. I'm dealing with a lot of messages after hours. And so was, again, taking great care of her patients. The patients loved her. And that's probably one of the reasons she was so busy is everybody felt very comfortable coming to and approaching her, but was starting to get to the point where she was getting to feel like this might have been a little bit unsustainable moving forward. So we looked at a couple of different things with her practice. The first thing we did is again, using technology, trying to help out with kind of cutting back on some of the after hours calls. So with her, we had converted her over to Spruce, which is the communication platforms that can handle her phone calls and her messaging. And with Spruce, they have the ability to create autoresponders and some kind of message features in there that allowed, so once a message came in after hours, the patient was then asked, hey, is this an urgent message that is going to go directly to Dr. Ulp, or is this something that could wait till tomorrow? And so by doing that, it allowed a lot of those non-urgent messages to kind of essentially get hidden from her until the next day. And so it really cut back a lot on her after hours calls and messages that she was taking care of. And so again, for her, spending time with her family and her children was really important. So cutting back on those after hours calls really was helpful for her quality of life and her home life. And so it was kind of a simple solution that we did there. We then kind of took a look at her office and said, she's got a lot of patients that are coming in a regular basis, and we wanted to kind of create a template for her schedule to allow it to be a little bit more sustainable. So what we did is we took a look, and this is where KPI kind of helped us out. We were able to map her phone calls and her text messaging through Spruce, because everything was coming through the same system. And we were able to find the hotspots of where are the times that she's getting a large number of calls or messages from her patients. And what we did is modified her schedule a little bit to give her a little bit extra time during those windows to say, if you don't have a patient scheduled right at this exact moment, it will give you a chance to catch up on your messages and let you be a little bit more efficient through the rest of the day. And that way, you don't always feel like you're playing catch up. You're kind of a little bit of ahead of the game of kind of getting some time to handle those messages. Once those messages are handled, you can then go back to seeing patients on your regular schedule, but now you don't have that kind of nagging feeling of I'm always missing some messages, there's a bunch of stuff waiting for me. I'm kind of able to be a little bit proactive. So it was kind of a nice way to pull some of the data, not only from the EHR, but then also from the messaging system, and kind of tie those together and really be able to kind of help construct her schedule and kind of her office flow to kind of be a little bit more efficient and kind of take care of the patients that she has. So Jason, I know you've worked with her a little bit as well. I don't know if you have other things you want to add on in this case.
Yeah, I mean, just to add some color to this. So Dr. Ulp, has a really young family. So she really wanted to practice 4 days a week in the office. And so that's why, typically, we don't have, physicians don't typically have issues with their workload in a DPC practice. Not saying that Dr. Ulp did, but really kind of packing in, a full week into 4 days was really important to her. And again, it's really comes down to her work-life balance needs and making it work for her. But she has a full practice, and so that she's able to balance that full practice, which in a DPC practice is between 500 and 600 patients total. Balance that and balance her family as well. So everything works out, and again, it's a win-win for all involved.
Yeah, so it was a good way of kind of using that data to kind of really help the operations of her practice. The other thing that we're doing, this isn't specific to any one practice, but we are starting to create these dashboards with the offices that we work with. And again, this comes through KPI Ninja, when they can go out and look at the different data coming from Hint, from a membership standpoint, from Elation or Practice Fusion or whichever EHR that we're using, and then also with Spruce or kind of our communication platform. We're really going to kind of get a nice dashboard of what's happening from a membership and financial standpoint, from a utilization standpoint, from operations in terms of your calls and your messages, and really trying to kind of figure out kind of where you're succeeding and maybe where there are some challenges. And so creating these dashboards where we can do them on a monthly basis, or maybe some more robust dashboards on a quarterly basis, really helps us kind of get some insight into the practice, and we're able to maybe modify some workflows or to find some areas where we can improve. The other thing that we're starting to do is actually benchmark this across multiple practices. I know, when I was in my own practice, I kind of thought I was doing a good job, but I really didn't know. I don't have anything to compare it to. So with the number of practices we have here at Freedom Healthworks, we're now able to take some of the same data and then compare it across the benchmarks amongst all of our practices to kind of say, does this number actually look good? And we can kind of look at some of those and say, yep, your office is doing really great on this one. Let's learn from you. Maybe we can help the other offices. And maybe there's a couple areas where, it looks like you're not doing quite as well in this metric compared to the other offices. Let's kind of figure out why and see what we can do to improve on that. So Jason, I know you've talked with a lot of the offices there. Have you kind of seen some of this in action so far?
I mean, yes, it's really kind of, this is our first iteration, so we're in the process of converting all our practice over to this dashboard. But I think it's going to be really helpful from us, our standpoint, because this is data that we can use to, again, to help create a better functioning practice, higher status, higher patient satisfaction, lower attrition, all of those things, and so benchmarking is really really important to that. But then it also gives the physician the ability to understand a little bit better how they're functioning, and so I think that's important to them. But this is really kind of just tip of the iceberg. I mean, there's a lot that we can do with the system, and I'll kind of get into that here in a second.
So yeah, so this is kind of some other things. So if you want to run through some of the other ways that we're looking at using data here moving forward.
Yeah, so a lot of times, our practices have a staff member, and so it's important to have things that help you manage that staff member. And so it could be calls answered, or that some of those more service metrics that will help you kind of guide what direction you take your front office person. So it really helps assist in managing your staff. Optimize workflows. We talked about that and gave you some examples. Adjust work schedules. Again, we talked about that example. And then here's a really neat thing that we can do. And again, this is tip of the iceberg stuff, but targeted patient outreach. So we have the ability to really target patients either that you hadn't seen in a long time. So we can set a limit as far as maybe you haven't seen patients. We can show all your patients that you haven't seen in 60 days, 90 days, 120 days. Re-engage with those patients, get them back in the office. It could be patients that share a chronic condition. So all your diabetic patients or something like that. If you want to reach out and do a workshop or something like that, or a shared visit, you can do that as well. So there's a lot of things that you're able to do as far as outreach with your patients en masse. And so that's a really neat thing. Reduce patient turnover. Again, it's about creating a really good experience. And again, it's about the relationship, but it's also about making sure that you're available to your patients, and guidelines are set with your patients how to communicate with you, and those things are important as well. So people need to feel like they're able to access you too. And we have run into issues where practices were a little overwhelmed and they were getting a little backed up, and maybe they couldn't get appointments. And really that shouldn't be happening in a DPC environment. But sometimes it takes little minor corrections to fix it. But it can also be guidance on medication dispensing. We can see what medications are popular, and maybe that will spur you to be able to offer those prescriptions in your office. And so again, it's about visibility and helping you manage your practice.
Yeah, I think those are all good sites. I mean, these are things even in my office as I sit and make decisions about staff members and our schedules and how do I block time. Right now I feel like I have a good feel, but as I continue to get busier, having some data to back up my decisions, I think will definitely be valuable. So that's kind of the key of really being able to pull this together. And so not only just going on a hunch, but actually having some data to back up, saying if this is what the direction we need to go. So I think there's some other things we're going to look forward to here with the data as we move forward here as well.
Yeah, so here's some things that we're working on right now with our data partner, KPI Ninja. And one is patient satisfaction. And it's a really important data point that helps support everything else. Is what is the opinion of your patients that are part of your practice? And again, it's really crucial for especially new practices, and understanding the patient expectations of you, and then communicating that back. It becomes a little bit less important as the practices mature, but again, it doesn't have to necessarily be as frequent, in my opinion. But again, it's a really good data point. But that's that patient satisfaction can also be integrated with growth initiatives. So if we understand what patients of yours that are really geared up about the practice and love your practice, then we can, maybe get them to spread the word a little bit more, and share, get them to post, positive reviews on Google or things like that. So, there's ways that we can integrate that within kind of, patient outreach and that sort of thing. But patient satisfaction is also really important on the employer side. So that's another really important data point that employers want to know is, if an employer is paying for this relationship, how important, how satisfied are they with the practices? And we can do that across multiple practices. So again, it's not just a one-to-one relationship necessarily with an employer. It could be a 5-to-1, it could be a 10-to-1, it could be a 20-to-1, just depending on the scale of that employer. And it really, again, this is all talking about providing data to employer groups. That data then that is practice level, again, they don't see everything, but they can see the things that are important to them. But that can be integrated with claims data. And so they're able to see a big picture of what's happening, how the practices are able to reduce cost or contain cost, see the satisfaction of their patients, see some of the interaction data, so how often they're interacting, which in a DPC practice, in our experience, interactions are way higher than with the traditional fee-for-service. But it doesn't necessarily have to be in-office interactions. A lot of times it happens through the technology platforms like Spruce. So that's, again, future ways, I would say, not so distant future ways that we're going to start utilizing data as well.
That sounds good. All right, well, I think that's the end of what we have prepared here currently. We do have quite a few questions here that we'll get through, so we'll start doing that. So I think the first question we had on here was, are we going to be sharing the slides? I don't think we're going to be sharing the slides per se, but we will be sharing a recording of the webinar itself. So everybody should be getting by tomorrow a link to the recording, so everybody should have that. There was a question from the chat that we had here. It's how do we think we can use communication technology to continue to show value for a membership model to our patients, so patients don't feel like they are paying for something that they are not using every month? And I think this is a crux of direct primary care, in that when we talk to patients about this model and patients are calling on the phone asking about this, how do we continually demonstrate that value? So I look at it kind of three ways. One way is the direct care that we provide in the office. So if you were to take the strict dollars and cents, how much would it cost me to go see a PCP in a fee-for-service model or at an urgent care or whatnot? How does that translate to the membership fee that we charge in the office? That's kind of one direct kind of value that you can show. The second area is in kind of the cost savings. So with some of our relationships, whether it's with labs or medications or imaging, how do we save the patient money on an ongoing basis? And so sometimes that alone is a huge saving for patients when they realize, hey, I've got to get labs a couple times a year. I take 2 or 3 medications, and you look at just the monthly cost of what it is, and we're able to save them money. That's a second area where we can see the value and kind of try to justify that value of the membership to the patient. And the third area is kind of like an intangible, if you will call it that. So, and this is maybe where some of the comments in this question is coming from. For a patient to kind of know that at any time I can pick up my smartphone and message my physician, and they're going to get it on the other end, and usually within a few minutes they're going to message me back. It's hard to put a price on that. And so that's kind of, sometimes it's hard. Patients may not have had a need for that yet. And so all you can do is continue to kind of demonstrate that, be responsive with your messages, share stories of other patients of, hey, here's a situation where we had with the patient, obviously kind of don't want to HIPAA violate, but you can kind of use it de-identified. But hey, the situation came up, a patient was able to contact us and we were able to get them taken care of. Maybe it was an evening or a weekend, or maybe it was just during the day, but because we were able to do it by text message, it was a very quick interaction and the patient was able to get their medical need resolved. So I think that's kind of the intangible value that you can kind of show. And so having that open lines of communication, whether it's by telephone, by text message, by email, just any modality that the patient wants, that really can provide great value to some of this stuff. Jason, I know you're a patient in a direct primary care office. We don't have to go say names otherwise, but how has it been on the patient end of having this ability to communicate with your physician?
Well, I mean, it's great because, my physician is extremely responsive. But it's to answer the question about showing value to patients. Again, they have to utilize their relationship with you differently, and they need to understand that it's okay to message you if there's a little, if you have a question about something. And they encourage it, and that's something in kind of the modern healthcare system that people just don't get. But once they start experiencing it, becomes kind of second nature. And again, that's what kind of, increases interaction with doctors, increases relationships, and all those things. So it's great, having access, because if I have a question about something, about a medication or something that I'm on, I don't have to wait and call the doctor or call the nurse or hopefully get through to someone and wait to get an answer back. It's really kind of a very cool experience for me to just interact with my doctor via, technology. It's very easy and simple.
Yep, and I think it's sometimes hard to explain that until a patient experiences that for the first time, and at that point, then it's sold. And so that's all I would say is continue to share stories and show examples, and at some point patients will kind of get it, and there will be some that will never get it, and that's okay. And you shouldn't waste your time trying to convince everybody. You'll find the right core of people that will be good, loyal patients, and will work with your practice. Next question we had here was talking about the Dr. Ulp case study. So it said, what technology was Dr. Ulp using before they converted to Spruce for the patient communications? Just phones or something else? And actually, yeah, so she was just using a basic phone service. And so, didn't really have any ability to track data coming in for her phone calls in or out. And so then getting her phones onto Spruce kind of gave us the ability to do that. And then she was actually using one of the other partners that we had mentioned here called Hail. That's another telecommunication app platform, and is a nice platform. I don't think it has quite the capabilities that Spruce does for some of the tracking. So by converting her over to Spruce, we were able to not only to get the messaging piece, but also the phone call piece all into the same system. And that really then gave us the insight to be able to look at that data and say, how can we structure her schedule or model that a little bit differently than we were doing before. So those are the systems that she had used and previously, and then when switching over to Spruce kind of gave us a little bit more insight on that. Dovetailing onto that question, we had a question about Spruce. She loves Spruce, but can't use it with her Spanish-speaking patients. Do we know of a Spanish-speaking patient, or is there a telehealth platform that has functions in several languages? And I will be honest that I don't know the answer to that question. I don't know if Spruce is working on trying to translate their platform into other languages or not, but I don't know, so I apologize. But if we do hear of something, we can definitely share it around. We'll usually post things on our social media accounts or things like that. But at this point, I don't know of any ways of doing things in other languages, but they may be out there. So we'll keep an eye on that. Jason, are you aware of anything that you've heard of?
Nope.
Okay. Another question we have here is, I'm not totally clear on what role KPI Ninja would play. Could you quickly explain that? So I'll tee this up, or I'll start from what I know, Jason, and then you can kind of take over a little bit as well. But KPI Ninja is a data analytics, or we'll call it a data aggregator to some degree. So when we use all of our individual systems, and we'll just use the three that we had highlighted before, Hint in terms of the membership and billing platform, Elation for an EHR, and then Spruce as our communication platform, they each have the ability to kind of do their own thing and run reports and kind of get some data out of there. But we don't have one way to easily look at the patient across those three systems. So if I wanted to say, for example, when's the last time I communicated at all with patient A, could that be a physical visit that may be documented in Elation, or could it be a phone call that might be documented in Spruce? Or is it that they are behind on their bill, which that data may come out of Hint? I would have to look at all of those three different systems to be able to get that information. So what KPI Ninja does is actually aggregates those data, the three sets of data together, and gives you one picture for that individual patient. So if I had a question of who are the patients that I haven't seen or even talked to in, let's say, a 3-month time frame, it'll query the same sets of patients from all three sets and then try to give me a report that will say, who has not been seen or talked to in our office in 3 months, for example. So again, they kind of aggregate that data together and then really give us some meaningful reports that is pulling a little bit of data from each of the systems as opposed to having to look at each one individually. So Jason, did I do a good job explaining that, or what would your take be on that?
No, that's a good start. But essentially what they do is they go way deeper into the systems themselves. So for an example, with Spruce, they're able to see how many calls you get, but not only how many calls you get, but when those calls occur. There's a lot of clinical data that can be pulled. that the individual physicians can use from Elation. Hint data can be integrated with all of that. And so there's just a ton of functionality, and we create kind of what reports we want to see using the data, the raw data from all of those. So you don't necessarily have to rely on, maybe the reporting packages of each, which, sometimes the reporting packages for the systems are a little bit lacking, I guess maybe. But we're able to really dig deep within those systems, and that's what enables us to provide the data that that the practices need and we need to help them succeed.
Yep. So again, I think it pulls it. So another example it might be, for example, is a clinical thing you just mentioned. So let's say we had our list of patients with diabetes. You can easily go into your EHR, whichever one you're using, and say, hey, show me the list of patients of mine that have diabetes. But then, in that same data, you can see when their last appointment was, because it's in the EHR data. But again, we do a lot of things that aren't related to physical appointments in the office. So we might do things by telehealth or by text messaging. So how do we then kind of put that data on top of it to say, I want to find those patients where maybe they haven't had a physical visit in a while, but also they have not had like a text message or an e-visit in a while. So you really are going to need some data from a different system to kind of cross-reference that. And that's where KPI Ninja can come in and pull that cross-reference together for you. So it really can be valuable in that sense. Those are all the questions that I see so far in the chat in our Q&A section. We've got a couple minutes left, so if there are other questions, feel free to type them in to the Q&A section or into the chat, and we'll be happy to answer those. And it could be about data, it could be about Freedom Healthworks in general, direct primary care. We've got a few extra minutes, so any and all questions are welcome at this point.
Yeah, and if you think of any questions in the future, please feel free to reach out to either Dr. Patel or I, and we can help answer those questions. Talk a little bit more about, maybe in depth, about these systems and how they work and how we utilize them. I know we kind of just scratched the surface on this today, but happy to talk about that and kind of what our model looks like. So,
I know you had mentioned it that the beauty of direct primary care is that every office is different. And so it's hard in a 1-hour webinar to really go through all the different scenarios of how someone might use the software or might set up their practice. And so if there's any questions about anything in particular, we can kind of definitely mention that. There's a question here about pricing. Can you discuss pricing, and do you have bundled packages with Spruce, Hint, and KPI Ninja? So I think, on the surface, we do have some preferred pricing on some of those systems. Spruce, Hint, some of those, being a member of Freedom Healthworks, we have some enterprise level packages with those. So again, the pricing is going to vary depending on your needs. And so that's where maybe to get some individual pricing, it'd be good to reach out. We can talk about that. KPI Ninja is something that we, at the Freedom Healthworks level, purchase. And Jason, you might want to have more information about that, but I don't think we charge individual practices for that type of service with KPI Ninja. Is that correct?
Yeah, that's correct. So the functionality of KPI Ninja is specific to Freedom Healthworks. So we partnered with them to create kind of the unique data sets that we see, the benchmarking aspect that's unique to Freedom Healthworks. So I believe they may have some individual DPC specific or practice specific data packages, but it's not going to be what we have because we develop that uniquely.
Sure. So yeah, so if there's more specific questions, all of the other systems we talked about have their own individual pricing that you can look on their websites and they'll have that ability. But I think, again, working at an enterprise level with some of these systems does give you a little bit more preferred pricing or some advantage on that, maybe some additional features. There's a question about Freedom Healthworks, our network. Do we bring more patients to our network practices? I'll turn that over to Jason, but briefly the answer is yes. I mean, that's one of the goals of anything that we do, whether it's from a marketing perspective, whether it's working with employers, having all of our practices work together, hopefully will help give us the quantity, give us some scale and will allow us to do better things. So I'll turn that over to Jason if you want to dig into that a little bit deeper.
Yeah, and that's really kind of our goal to help fuel the growth of direct primary care is really tying into patients. So we're doing a lot of work with employers, but that's going to be very, very area specific. So right now, kind of our focus with that is going to be Illinois, Indiana, Ohio, Midwest, North Carolina, South Carolina, parts of Georgia. And, over time that will spread. So what we're doing really is finding the areas of demand and finding, and those become opportunities for doctors to be able to launch a DPC practice or transition a DPC practice, while hyper accelerating the growth of that practice. So, that's the tough part. I know a lot of independent direct primary care practices struggle with growth in a lot of cases. And we're trying to solve that. We're not everywhere at this point, and we're very specific as far as kind of the focus that we have. And I think all of you guys, as DPC physicians, if there's any of you that are practicing in DPC right now, but we're kind of cutting edge at this point, so we're kind of right on the cusp. And I think there's going to be some serious growth in DPC over the next couple of years.
Yep, definitely is true. And I think it's, whether it's through us or through other mediums out there, Facebook groups or kind of other academies, even there, I think we're a big community that are working together. And so anything we can do to help spur that movement is important. So,
yep.
So yeah, well, I don't see any other questions. We'll hang on for just another minute. It's a little 1 minute after the hour. But otherwise, we do appreciate everyone for joining us today. Again, we will send out a recording of this webinar. So if you wanted to go back and review it, or if you have colleagues or friends that weren't able to join us this evening, you can share that video with them and go from there. Otherwise, we appreciate it. Hope you enjoy the rest of your evening, and we'll go ahead and sign off then.
Okay, thanks everyone.
All right, thank you very much.